Now we're going to talk about data sources because there's a lot of different data sources out there. Some are obvious, some are not so obvious. They do have costs and benefits and pluses and minuses. So one example is if you're going to do a survey, you could do a phone survey, right? And you could randomly generate numbers so that everyone has an equal opportunity to get in there. The problem is that who answers the phone you have to take, and you don't know if they are who they say they are. You don't know if they're the age they say they are. And if you're doing a phone survey and you're looking for people who have phones and you don't necessarily get cell phones included in that, then you're going to exclude a lot of people who don't have landlines. So there are biases in how you get your samples, something to think about and to remember, and you'll have validity issues based on how you get your sample. But also some of the ways that you get your data also has biases and validity issues in them too. There's administrative data like secondhand data, and that could be, medical records, clinical procedures, diagnostic stuff, procedure codes for services, location of services, and billing, right? They're big data sets. It's really great. They're de-identified, so they're easy to use. The problem is you have to go by how they define and how they are collecting their data and the biases that they have in their data collection, which usually they will say. So the advantage is it's usually available electronically, so you can download it. It's not that expensive as opposed to going through medical records and having to recode the data. You can get a huge population against lots of players and lots of locations, and it's uniform again because they have specific ways they're collecting the data, specific ways that who's in and who's out, ways that they randomly sample things. The challenge is that you're going to get limited clinical information, and you have to say, well, do they bill the same things, and is there honesty in the way that they're billing and the way that they're coding? And we all know that there's upcoding, so that may or may not be. It may be incomplete, and it may not be available. Last year's may not be available. You may have to go 2 years back because there's a lag time with that. Another thing is patient records, and a lot of you will want to do this. The advantage is that you get the incredible amount of clinical data, right? And you can go backwards and forwards depending on how much electronic data there is. It can be seen as very credible. It has a lot of information. It doesn't just look at one thing. There are challenges though. It is very expensive because you have to go through and code all the data. It can be complex and you have to compile the data. Different places use different records. Some have electronic, some don't. Different doctors, different nurses actually do or don't fill in all the data, so you're going to have a lot of missing data. You can have a rich file for this person and not for this other person. And you have to train staff or who's ever collecting the data on ways to put it into a database, so that can be costly. You can do patient surveys, right? Those are huge and big and things like that. Again, you have to look at what are they actually measuring, so that's a problem, right? There's some validity there. Who actually takes the survey, who responds to the survey? It could be people who are really happy with it or people who are really not happy and nobody in between. So you're not really getting a real unbiased look. So there's selection bias there. Again, internal validity issue. Things to keep in mind. It does capture information of which patients are the sole source. It does give you a way to administer information. Again, you have to look at how they're asking the questions and how they're defining things, and is that understandable from patient 1 to patient 2? Because I might have a different understanding of cleanliness versus you. So you want to really look at the survey and how it's administered and how it's asking the questions to see if you really want to use it. You can relate to the survey results based on what customers say. Some people have a problem with looking at patients as customers. The challenge is that the surveys are very expensive to administer, so they may not get a huge sample. For you to administer them are going to be very expensive also. Also, there can be misleading results. The words could be poorly, right? So that's a construct validity issue. They could not be a random sample of a population, so you're going to have selection bias, which is an internal validity issue. Also, you can have response bias, like I said, really happy, really not happy. You can get comments from individual patients, right? The problem is that you get a lot of information. It's rich information. It can tell you how people's behaviors and decisions are being influenced. The problem is that they're not collected systematically, and sometimes there's a selection bias. People answer if they really like it or really don't. Their comments are not always, it could be based on a one-off incident. It may not reflect the entire patient practice or the entire way someone is. There's also things like standardized patient records, right? Outcomes and assessments, those are sets of data. Public health data is standardized. Again, the problem is you have to get access to it. It can be costly, it can be difficult. You have to get what they collect, not what you might want. So there are lots of different sources of data, but you have to sort of think about the embedded biases or issues that can relate to internal validity, that can relate to construct validity, that can be embedded in these outcomes, these issues, in the way you collect the data. So you need to think about that. Timeliness and costliness is very important too. And if you are looking at patient records, you also have to make sure that they're de-identified and that information can't go back together because of ethical issues. So these are kinds of things you have to think through in how and when you collect the data and what are your data sources. And also things to keep in mind because you are on a timeline, and also things to keep in mind when you're reporting the data.